Welcome to the deep dive. Today we're plunging into something huge, healthcare, specifically for our aging population.
Yeah, it's a massive global challenge.
Absolutely. The strain on medical resources is already immense, and it's set to grow dramatically. Think about this. By 2050, the number of elderly people could hit 2.1 billion.
That's a staggering figure, and it really underscores the need for new approaches. So our mission today is to explore a pretty cutting-edge cloud-based framework.
Yeah.
It uses something called digital twins.
Digital twins.
Exactly. The idea is to revolutionize elderly healthcare,
Yeah.
make it faster, yes, but also much more precise, truly individualized care.
Okay, let's unpack this. How this, futuristic technology actually starts tackling the very real problems we see in healthcare right now. I mean, if you look at the current situation for seniors, it's often, complex. You've got chronic diseases everywhere, hypertension, diabetes.
Very common, yeah.
And then there are problems like diagnosis accuracy sometimes being low, and that really frustrating 3 long and 1 short thing you hear about in hospitals.
Ah, yes, the long waits for registration, appointments, payments.
Right. And then a really short actual treatment time. It just highlights how much we need, continuous monitoring, real-time guidance, moving past just reacting when something goes wrong.
And that is exactly where digital twin healthcare DTH comes in. Think of a digital twin, like a dynamic virtual copy of something physical. It's a whole life cycle.
Okay, like from manufacturing. I think I've heard of it there.
Precisely. It started in industry, but applying it to healthcare is, well, transformative. DTH is this new way of doing medical simulation. It combines the physical, maybe a wearable device, or even the patient themselves, with these detailed virtual models, plus a constant flow of real-time health data.
Here's where it gets really interesting. How does this virtual world actually connect with and influence our physical health day to day?
Well, the key is this constant feedback loop. So DTH starts by building these really accurate digital twin models. Then you need that real-time data connection. That's often through the health IoT, the Internet of Medical Things.
Connecting all the devices.
Exactly. This steady stream of information allows for dynamic simulations, checks, validation. It means we can get insights quickly and keep refining the model to optimize care. DTH work on 2 levels, really. For hospitals, it helps with management, like simulating patient flow or resource needs.
Ah,
And for patients directly, it gives doctors real-time data to pinpoint symptoms and figure out the best treatments with way more precision than before.
so if DTH is about the individual twin, then cloud DTH. That sounds like the bigger picture, the cloud framework that brings all these twins together,
That's it exactly.
aiming for things like sharing resources better, distributing services smartly, and just getting bigger benefits for hospitals and patients.
Precisely. Cloud DTH is built to be robust, scalable. It pulls together key technologies, health IoT, for getting all that data, obviously, then powerful big data analytics to make sense of it all, and crucially, really strong security. Things like blockchain, actually.
Blockchain for health data.
Yeah, to create this unchangeable, transparent record, it guarantees data integrity and protects patient privacy, which is, absolutely vital.
So what does this all mean for you, for someone listening? How does this change their personal health journey?
Well, it really translates into continuous, proactive health management, guiding you through everything from monitoring to diagnosis, treatment, and checking how well it worked. We've seen this in case studies. For example, an ECG device linked to cloud DTH can spot arrhythmias.
Okay, standard monitoring.
But here's the cool part. It doesn't just flag the problem. It gives individualized medication suggestions based on your specific genetic profile, how your body actually processes certain drugs.
Wow, okay. Like pharmacogenomics?
It's exactly that. So maybe your genes, say a DPYD-TA type, mean you need a lower dose of a chemo drug like Fluorosil. The system flags that. Or if you have a CYP2C 1922 gene type, it might strongly advise against using clopidogrel, that common blood thinner, because it won't work well for you or could cause issues. That's real precision medicine.
That's incredible.
And it's not just individual treatment. Think of a resource optimization system-wide. The system can simulate, say, hospital capacity. What happens with 100 beds versus 200 during a sudden peak?
Like a heat wave causing more elderly emergencies.
Exactly. They can model those scenarios to help make sure the right resources, beds, staff, equipment are ready where they're needed most. If we connect this to the bigger picture, it's about moving from just reacting to illness to being truly proactive and deeply personalized in how we care for our aging population.
So what we've really unpacked today is this huge potential of cloud It seems poised to tackle the really complex needs of elderly healthcare using, well, precision and real-time action in a way we haven't seen before. It's clearly more than just collecting data. It's about intelligent, adaptive care.
Right. And this raises an important question. As these virtual health doubles get more sophisticated, how might that change how we even think about personal well-being, the whole nature of patient care, maybe even what healthy means?
That's a deep thought. It definitely leaves us wondering about the future implications, doesn't it? These integrated, intelligent health systems. What will they mean for generations to come? Imagine having a digital twin sort of walking alongside you, anticipating your needs, guiding you towards a healthier future. Something to think about.